My name is Kirstin Birtwell. I'm a clinical psychologist at the Lurie Center. Thanks so much for joining us. I'm impressed in the busy month of December. There's so many people here, so thank you so much for joining. I'm going to turn it over to Nicole, our senior behavior analyst, and she's going to start us off.
Great. Thank you, Kirstin. Welcome, everyone. My name is Nicole Simon, again, the senior behavioral consultant at the Lurie Center. So our roadmap for tonight, we are going to give a very brief overview of what applied behavior analysis is, for those of you who are not familiar, or a review for those of you who are. We'll talk about some elements to look for in an ABA program, and then we're going to get into how to set meaningful goals with your ABA program and how to work effectively with your team. We would ask that if you have any questions that you please write them into the chat, and then we will definitely be planning to leave time at the end of this discussion, at the end of this conversation for a discussion. So that's the best way to ask a question. Okay. Next slide, please. All right. So applied behavior analysis, when I talk about ABA, I like to think about it in terms of its broadest definition, and that's what you have in front of you. Applying behavioral principles such as reinforcement in real world settings like schools or at home or in the community to address socially important issues. And these can be things like communication or play skills or academics, a variety of socially important issues. If you're here tonight, it's probably because you're interested in ABA as it relates to autism. However, you may not know that ABA actually goes well beyond autism and well beyond even the field of human services. It can be used in the environmental sciences to tackle climate change. It can also be used within transportation safety. And I think the reason why that's important is because we oftentimes get into this battle and discussion of who is ABA right for and who would benefit from it. And I think when we step back and realize that these behavioral principles apply to all of us, it helps us tailor that discussion a little bit, and that it's not so much about whether or not ABA can be useful. It might be more about what type of application would be best for a particular individual. We know that ABA is effective across the lifespan, so not just for children, but also for adults, and that it focuses on teaching skills as well as improving behavior. So what do I mean by this idea of behavioral principles apply to all of us? Just give an example that applies to this talk right now. We gave all of you the instruction to ask questions in the chat if you have any. And so let's say one of you had a question and you typed it into the chat and it was directed to me. And I responded to your question by saying, "Thank you so much. What a brilliant question. I love that you asked that." And then I gave this wonderful answer that, that satisfied you and gave you the knowledge that you were looking for. Let me ask the group, thumbs up if you or anyone else in the group would be more likely to ask another question later on in the talk. All right, I'm seeing thumbs up. Good, and we're just go back to the previous slide, please. Yeah, so that is right. And what is that called? That is called reinforcement, right? I have reinforced your behavior and made it more likely to happen in the future. However, let's say you then typed in your next question and it was directed to Dr. Birtwell. And she reads your question and responds by saying, "Are you kidding me? Is that a joke? You're asking me that question? Wow, I can't believe that." And then proceeds to just, ridicule you and not answer your question, which by the way, she would never do. This is just, hypothetical. Thumbs up if you would ask a question again of Dr. Birtwell. I'm not seeing thumbs up. Thumbs down if you wouldn't. Yes, thumbs down. And so what is that called? That is called the principle of punishment, right? Dr. Birtwell would have punished your behavior and made it less likely to occur in the future. So once again, these behavioral principles happen to us all the time, all day long. We don't think about it. I'm probably the only person as a behavior analyst who tends to think about these things. But I think that there's when we think about it in that way, these behavioral principles applying to all of us, there's a wider applicability of ABA than many people realize. Next slide, please. So something you might know about ABA is that there is a lot of research, evidence-based research for it being an evidence-based treatment for children with autism. So several decades, support by the US Surgeon General, a lot of funding that has gone into that research. And what it's led to is legislative rulings that have supported funding and increased access. So within Massachusetts, we have the Eureka Law in 2010 that essentially means that if a child has an autism diagnosis, that they are going to be able to access ABA, and it's likely going to be covered by their insurance. And right now, really across the country, most states, I think at this point, I think all states have a similar law that covers ABA for the diagnosis of autism. So this is something that was not the case 20 plus years ago. It was a lot harder, to access ABA. Only people who could either pay to privately access the services or who would sort of educate themselves to provide services within their home were going to get ABA. Now it's much more available both through the school systems as well as through insurance companies from a funding stance. Next slide, please. So what is the overview, the process overview? Again, this is kind of bird's eye view, very, stepping back and looking at it. It starts with observation and data collection. So we want to know, what does that behavior look like? Very specifically, we create what's called an operational definition of a behavior that allows us to then take data on that behavior when it occurs and when it doesn't. We also want to identify, are there any patterns as to when the behavior occurs? Next. Once we understand what the behavior looks like and we have a definition for it and we've started to take data, we want to understand, why does that behavior occur? And in order to figure that out and to essentially get a hypothesis, we will do what's called a functional behavior assessment, or an FBA, or a functional analysis. This will give us a hypothesis about why that behavior is occurring, including possible triggers for that behavior. Next. And then once we understand why that behavior is occurring, we can then determine what are appropriate interventions using behavioral principles. How can the behavior be changed? How can it be generalized to other people, to other settings? And how can it be maintained over time outside of that treatment setting? We will also think about how can we teach new skills. But I just want to mention this briefly. Some of you may have heard of discrete trial training, or DTT. That is a very sort of specific type of teaching methodology that's typically one-on-one, highly structured, quite repetitive. It might involve things like matching or sorting, or do this, touch your nose, touch your head. You might have seen that or heard of that, and you might think that wouldn't be helpful for my child. My child wouldn't benefit from that. And if that's what ABA is, it's not for me or my family. And the reality is that is just one type of teaching methodology within ABA. There are dozens of others that might be more appropriate for your child. Next slide, please. So 10 elements to look for in an ABA program. This is based on sort of our clinicians and our experience in being a part of ABA programs and our knowledge of ABA. Number one, and this one is so important, the individual, your child's own goals, needs, and well-being must be first and foremost. It must be at the center of the table, the center of discussion. If your child can participate in that conversation, they absolutely should, but that needs to be the number one focus, okay? Closely following that is the role of you as family and caregivers, right? So you should know, you do know, that you know your child best, you've known your child the longest, and that you absolutely should have a voice at the table whenever there's any professional involved in the care of your child. So you should be involved, you should feel appreciated. That knowledge that you have should be appreciated by the team and respected. As well as there should be a respect for the role that you're playing at home, which could be quite a challenging situation. But if you have sort of a gut feeling that you're being excluded, that, you know, the team knows best and they don't care about what you say as a parent, that's a red flag, you know, of a concern that would indicate maybe not the best ABA program. That environment, and this sort of goes along with that too, the environment that the ABA is taking place in should be positive and therapeutic and supportive, safe, and fun. If you're walking into a space where ABA is present and you're seeing that the staff members who are working with the individuals are on their phones, they're not paying attention, maybe the individuals are sitting on beanbags with headphones on, they're not engaged, whatever it might be. Again, if you're not getting the vibe that the staff members really care about the individuals that they're working with, and there's a good working relationship and there's sort of active involvement, that's a concern about the environment. Again, you're going to probably get a gut feeling that this may not be the best situation and may not be the best fit. Conversely, you walk in and people are having fun and smiling and laughing and learning, that's a great example of an environment. A good environment. That clinician in BCBA, we want to make sure that they have experience with individuals like your child, similar profile, and that the staff that are working directly with your child are trained in ABA and supervised. You could have the best clinician or BCBA in the world. If there are not trained staff working with your child and supervised staff, it just doesn't matter. So those components are really important. Assessment, critically important. That is the foundation of ABA. That's how we develop goals. We're going to talk about that a little bit later, but it's all based on assessment. If there's a behavior plan, there better be an FBA that came before it, right? Otherwise, we don't even know where to start with developing one. So assessment cuts across behavior as well as skill development and skill programs. Programming and goals should be strength-based and individualized. This is also important. Cookie cutter types of programming is not going to be something that's a mark of a good program. It should be tailored to your child and certainly focusing on your child's strengths. Data absolutely needs to be present, and it needs to drive decision-making. Should not be just sort of anecdotal experiences, opinions that are helping to make decisions. That can be part of it, but the data of how the skill is it improving? Is it not? How's that behavior doing? Is it decreasing? Is it not? That should help drive whether or not a change needs to be made. The progress should be meaningful. This is, again, is a topic we'll talk about a little bit later today, what that actually means. But if somebody's telling you, a team is saying, yep, your child's making progress and you're not seeing it, or you're not experiencing it, or you don't even know what that means, that's, again, a question you want to go back to the team with and get a better understanding and make sure that that progress matches, you know, what it should be. It might be slow progress, by the way, but we want to make sure that we're making systematic growth compared to the previous year or the previous time that the team met. And then lastly, a multidisciplinary team approach is utilized. This is also critically important. I think that behavior analysts can be and have been historically criticized for, being people that think they can do it all. Like, I don't need the help of speech. I don't need the help of a special educator. I don't need a psychologist. I've got this. And there are behavior analysts like that. But I think that as we've grown as a field, we realize that we do our best work when we collaborate with other disciplines who look at things through their own lens, and we work together. It might mean, one might take the lead in program development, but getting that additional approach and additional assessment can be extremely helpful. And so this is another piece where if you have a behavior analyst who's saying, we don't need to do any other assessments, I don't care what your outside speech said, we're doing this all on our own, that is a red flag again, and something that you want to be cautioned against. Next. Current challenges, I think it's important to talk about this because there's a lot of wonderful things about ABA, but there are also challenges. These are real challenges. These are things that you as parents, if you've already started to receive services, if your child's receiving services, you probably experienced some challenges. And so I'm gonna go through some of them. You might have more to even add to this list, but we know that there's a growing ASD autism population. And I think as that started to happen, there was this recognition that we have this now, evidence-based treatment, ABA. There's a high need for individuals to provide this service. A lot of young people kind of went into the field of ABA. A lot of new programs opened up. And what sort of happened over time is, I think, some of the quality of ABA programs started to depreciate a bit. And the inexperience of these clinicians really started to show through. What's unfortunate, I think, is that there are certain organizations that look for that credential, that BCBA credential, and hire a clinician with that credential, because that's what the requirement is, but don't necessarily take into account the experience. And so you might have somebody who's just gotten their, master's, just gotten credentialed, and they have a 1 year of experience, and that could be with a very small subset of the population. And now they're in a role where they're being asked to develop programs and train and supervise staff, and it might just be beyond what their skill set is. So it's we're seeing that there's that high quality is harder to find. And I think that's been frustrating for parents. Coupled with that is high turnover. RBTs, by the way, that's registered behavior technician, or it could be a paraprofessional, typically the direct care staff, the person that is working directly with your child. We can see a high turnover rate in that role, partially because it's not well paid. It also partially is because those RBTs who really love the field might do that role for 9 months or a year and then want to move on to get an advanced degree to become a BCBA. So that role turns over quickly. BCBAs turn over quickly. That can directly impact your child, right? It can be such a struggle to get good services, but then when you do, and you get that person that your child really connects with, or that clinician that you really connect with, but then 6 months later they leave, it's just devastating. And there is a real impact that we see in terms of how your child might be affected and how your family might be affected. There can be a high cost of services that aren't always covered. And adult services goes right along with that. We certainly see more coverage and more availability for services for children versus adults. I think across the board, there is a lack of diversity in terms of the, clinicians offering these services, and compared to, the clients and the folks that they're working with, there's a real mismatch there. So we're, as a field, trying to increase the diversity of BCBAs and clinicians who are offering these services. And then I just think in general, and this is something that you'll hear, it was a little bit more of a focus of our last talk, but there are families and children and adults who've had negative experiences with ABA. That could be just because it wasn't a fit, like, with a particular individual, it wasn't a fit, but there was a philosophical difference, or it could be that potentially maybe there was misapplication of ABA. And so what we sort of just talked about in the last slide, that good ABA or a program with some of those elements wasn't the case, and there was a negative experience. And so I think, like with anything, we need to validate those experiences. I think that's real. We can certainly listen to it, learn from it, and use that as, okay, what maybe happened there, and kind of be mindful of what's happening with your own child. And when you have those questions, bring those questions to a trusted professional. If your child's at the Lurie Center, certainly there's a number of folks who can talk with you about what that ABA experience should be like, and also, if it's not a fit, what other alternative, non-ABA but evidence-based alternatives could be. Next slide.
Great. Thank you so much, Nicole. So now we're going to turn a little bit to kind of who makes up this team that we keep referring to. So when we talk about ABA teams, we really are talking about, not just the direct service provider. I think that's really important. And so I think a lot of parents really just think about ABA as being kind of delivered and run and executed through their kind of, tech or their therapist or their RBT. There's a lot of different kind of names. There's a lot of jargon in this field, as I'm sure everyone here tonight has learned. But really, when we think about a team, again, we're really talking about your child, very much so a part of that team. There should very much be, Nicole has talked about this a little bit, there very much so should be a supervising BCBA. So there really should be a board certified behavior analyst. So someone that has received education and credentialing specifically to design, collect data, analyze data, and supervise these programs. And really, like Nicole said, someone who's experienced with the specific profile that is your child. And this is your team. This is a really important kind of collaborative approach. Everyone should be really aligned. We're going to talk about goals in a minute, but everyone should be really aligned on what the goals are for your family, for your child, for the care team. There might be a number of kind of non-ABA folks that are also collaborating: speech therapists, occupational therapist, perhaps a psychiatrist, a psychologist. There might be a really active social worker or a psychotherapist involved. So, your specific ABA team, you can really think about, as it says here, your child, the BCBA, and the tech. But when we think about the various teams kind of functioning in this way, that really does expand quite a bit. And I think multiple voices and a lot of communication is always best. And we'll give some strategies on maybe how to go about that. But when we do think about ABA service execution, there's a couple different kind of domains through which we think about ABA being executed. So we think about school-based, and that can be either in the context of a public or a private school. A lot of private, highly specialized schools, for example, might almost exclusively use ABA as their teaching methodology. Public schools might include ABA as one service that they're providing. And the importance of the IEP service grid is big here. And that's really kind of just documenting the different players and the kind of dosage that you're getting of ABA, right? So, when we think about the IEP service grid, if everyone kind of is familiar with this, there's three kind of different levels of that. The first level is the consultation part. So that should be where the supervising BCBA kind of is reflected. So there should really be, again, on the IEP service grid, if your child is getting ABA in school, it's really important that there is kind of documented, weekly or sometimes it's monthly consultation from the supervising BCBA. So that's really, really important. And then the IEP service delivery grid also reflects the kind of the way in which IEP is actually delivered within the school setting. There's also home-based, so I'm sure a lot of people have experienced or are seeking in-home ABA. So this would be literally ABA that would be coming to your home. They would be working on things very similarly to probably the school environment, but the benefit of that is that it's in your home environment. So the goals might be a little different. They might be more kind of family focused. They might be working perhaps with a sibling on social skills, for example. They might be directly working on things like bedtime routines or kind of showering routines or hand washing routines actually at the sink that the child uses. And so there's the benefit of that. And then, so you have school-based and you have home-based. And then there's kind of this middle area, and that is center-based or called clinic-based sometimes. And so that would be at an ABA center, which might have, a sink set up, for example, to teach at a sink, but it's not directly in your home. And so for some families, I think one of the things we keep going back to is how important it is for ABA to be individualized and for it really to reflect the needs of the family and to be contextualized in that way. And so for some families, they for a whole variety of reasons, in-home ABA just might not be a good fit. So if you're needing additional hours of ABA outside of school, center-based or clinic-based is a really, really nice option. And then this last point, I just want to touch on really quickly, and we'll talk about this more. But again, thinking about the team integration and the carryover. So say you do have, if we think about school-based, center-based, and home-based, say you are fortunate enough to have, 2 of the 3. It's really important that those 2 teams are talking to each other, right? So that they're not addressing goal areas in different ways, that they are, there's consistency in programming. Like, for example, if we're thinking about addressing an unsafe behavior, it's very important for that child to have that consistency in terms of how that problem behavior is being addressed. So the team integration and then the carryover to different settings is really important. All right. So how to set meaningful goals. So we've talked about some of this, but again, I can't stress enough how important kind of family and cultural considerations are. Like Nicole said before, ABA that feels overly kind of templated or kind of prescriptive really is not what ABA is meant to be. It is meant to be highly individualized. And so it's really important that there's a very complex assessment done in the beginning when you're just starting to kind of set up this type of service. And that should reflect not only, the skills of the child and figuring out where they are, but also very equally taking into consideration, the family culture, the family context, and what's important for what is a priority for the family. So obviously, when we think about goals, the age of the child is important, the developmental and the cognitive level of the child is important. The environment in which the ABA is being executed is really important. Safety is something that, one conversation I'm very frequently having with families is, families really have a lot of kind of priorities for their child. Of course they do. But it's really important that maybe some have to kind of be ordered in a way that takes into consideration their access to those other services or to those other goal areas. And what I mean by that is if you have a child that's engaging in significantly aggressive behavior, they're really not safe. They're not at a place where they can actually access programming in order to address all of these other really great skill areas that the family might want to address. And so it could be that there's kind of higher priority goals that need to be addressed first, and that subsequent to that we can start to work on some other things once the individual is in a little bit more control. So meaningful goals always do again start with really comprehensive assessment. So Nicole mentioned FBA, which is functional behavioral assessment. So that's kind of one assessment that should take place in schools in particular. There's curriculum-based assessments. Folks might have heard of things like the ABLES or the VB MAP. Those are specific curriculum-based assessments. And what I'm referring to by that is, so a lot of the assessments that we do, for example, in a neuropsychological evaluation, you're comparing the data of your child to the larger population of their kind of peer group. And so curriculum-based assessments, what that's really referring to is you're comparing the performance of your child on a particular test kind of to themselves in a way. And so it's really important that we think about how to track progress and use these means to do that. Another assessment that might be specific to your child, if your child is transition age or an adult, would be vocational. And then, we've talked a lot about this kind of team approach, and that very much so should take into consideration speech. A huge part of ABA is communication, is functional communication training. It is how the individual is able to appropriately ask for something. And so a really strong and comprehensive speech evaluation is hugely helpful. OT, kind of same thing. There might be some sensory issues, there might be fine motor issues. PT would be referring to gross motor. And of course, academic assessments and potentially neuropsychological or psychological assessments. And again, keep going back to this point, but it's really important is goals should be really highly individualized and they should be meaningful. And so, again, just some things to think about. It's really important that when we think about ABA, even though we often talk about it in an educational sense, we're really not just talking about academics, right? So this is really talking about things like functional life skills, independence and interdependence, quality of life, safety, and this whole idea of the importance of kind of the whole family system, the whole household functioning. It's really important. Another important point is that the goals for ABA should be both objective and measurable. So both those things are really important. So this is a really good example taken directly from an IEP that I've seen recently. So when given an array of pictures, this child will receptively identify 3 prepositions with 90% accuracy as averaged across 5 consecutive sessions, right? So that kind of checks all the box. It is incredibly specific. It is certainly measurable from an ABA standpoint. And knowing this child, it is certainly achievable, in the year. It meets the child where they are. It kind of, again, it's kind of moving the ball forward in an appropriate way at an appropriate pace. And it's just, it's a fairly simple goal area, but it's well written. And then, one thing that Nicole and I always talk about is how important it is that, so when the goal is considered kind of met, right, there's 2 things that kind of need to be done after that. And that is that, achievement of a certain skill really needs to include these 2 big things of generalization and maintenance. Nicole touched on generalization a little bit, and that is, again, kind of if a child has learned how to identify a stop sign, right? Say that they're sitting at their desk at school and they're able to match a stop sign. So they're able to identify a stop sign using matching, and they're able to do it at their desk in that specific area, and they're using a specific kind of card or icon or picture in order to match, right? So say they meet that goal of matching in order to kind of, learn the stop sign. The stop sign actually isn't kind of learned yet, right? So they need to be able to deliver that skill or kind of showcase that skill in different settings with different materials. Are they able to identify a real stop sign, right? There's a lot of generalization that can happen. Are they able to do that with one specific tech or teacher, or are they able to go home and do it, with mom or dad, for example? And then the maintenance of that skill over time. And so, I think when a lot of us are asked to do long division, it's pretty clear that if you don't do that for several years, you completely forget how to do it, right? So these things really need to be maintained over time. It's really important for our learning process and our memory. And then, again, so goals should be achievable within a year. If it's achieved before 1 year, that's fine. That's great. The team can just reconvene and they can really think through, what that goal area should look like next, or how that can be modified. And usually what we recommend and what is kind of standard is that the team meets to go over data once a quarter. And so that's really important, is, basically what that's saying is every few months, it's really important to get everyone in a room and to review in detail how the child is doing on specific goal areas. And again, the pace of progress might be different for a child at any given year in any specific goal area, but it's important for that to be data driven and communicated very openly with the family and among the team. And then that would be a really good place to address barriers. All right, so just a couple of examples of kind of scenarios, and Nicole, feel free to jump in and weigh in on these. But so these are kind of some examples of things that we might hear in clinic. So shoe tying has been on your 12-year-old child's IEP for 5 years. He still doesn't know how to tie his shoe. Do you keep it on there? Right. So that might be a question that we get. And so, the way that we might address that is, okay, how were they teaching shoe tying, right? Is it possible that we need to have an OT eval? How is it being executed? Are the materials kind of, not working for the child? Do we need to, are they just practicing on a real shoe? Do we need to have, larger laces that are easier for the child to grasp? What does that actually look like? And it could be that, so I think, the message here is that the automatic response shouldn't be no, drop shoe tying, or no, keep it on, right? It's a very individualized discussion that has a lot of components. So how are they teaching it? Is there another goal area that's really important to the family? So what's written here is like, perhaps we start to think perhaps toilet training is a more kind of important goal, given that the child has a lot of other shoe choices that don't require tying. Another example is your 4-year-old has 75 objectives on her IEP. They include a lot of jargon, words you've never heard of before, like manned and tact. How do you know if they're targeting the right skills? So again, lots of communication should be happening among the team, and you are very much so a member of the team. So ask. It's really important for things to be communicated in a way that parents understand. I think a lot of these types of vocabulary words are kind of spit out by some of these assessments, and it's really important that if you don't understand something, that you ask, and that it possibly even be rewritten so that you do understand, and so that it's written in a way that is really readable. And then the last example, your child is receiving home-based ABA services 6 hours a week. During these sessions, the therapist works one-on-one with him on academics such as matching and sorting, and he has no behavioral issues. When the therapist is not there, as soon as the therapist leaves, the child is aggressive towards yourself as the caregiver and his sister, and has difficulty with, say, hand washing, right? What should you do? And so again, it's just really important kind of compilation of goals, and it's really important that the family function and adaptive skills, safety, these are all components that need to be considered. So it really is a balance, and it could be that at various times within the execution of the ABA, that there's different kind of priorities being worked on. So just, the next 2 slides, I believe, are just kind of some tips and kind of ways to think about just how to work with the ABA team effectively. So we've talked about some of these before, but building a relationship with the team, making sure that you really do understand that you are an active member of the team. You are a very important member of your team. for those of you here that are parents or caregivers, like Nicole said, no one knows your child better than you. If you're seeing something at home or not seeing something at home, that's really important for your ABA team to know. And, you know, a good kind of, you know, caring therapeutic ABA team will want to know that. That's really important information for them to know. Establishing communication guidelines are huge. So it's really important that, you know, so of course there's team meetings. We've already talked about how those should be at least quarterly. So you kind of have those, you know, scheduled and standing and to look forward to. But then beyond that, how does the team, how would the team prefer communication be had between, you know, the family and the ABA providers? So, you know, depending on what it is, it might be important for it to be written. Would a phone call be important for you to kind of talk through it? A lot of parents just have direct email contact with their BCBA, and sometimes that's important and easy, and also you can kind of go back and look at it. So what's the best way to establish kind of a good mechanism of communication in order to do everything we're saying and kind of to work effectively? Request data, you can always ask to see the data of your ABA team. So that doesn't matter if it's school-based, home-based, or center-based. It's really important for everyone to know that that you can always request to see your child's data. The team might need a couple days to kind of get it together for you in a way that makes sense. But I think that if you're concerned about something, or you're curious about something, or, you know, a psychiatrist wants to see the data, that is always something that you're able to request. That is certainly within your right. And then it's just important that both you and your team are documenting any major event, any changes. You know, for example, if there's a change in your medication, it's really important to tell your ABA team so they're able to kind of think about that when they think about the data of the behaviors that medication might be targeting. And so documentation is also really important. I just wanted to say a little bit about school-based advocacy. I do want to make sure we leave time for discussion and questions. But, you know, as I said, there, you know, you are always allowed so this is specific to school-based ABA. So you're always allowed to ask for a team meeting to discuss, you know, any concern you have, any changes that come up, your concerns that, you know, if your child, you know, comes home and says, this happened, or, you know, you'll want to just have a meeting and talk about it with your team. Any concerns about your child's progress, of course, just need to be discussed first, and then there can be a plan in place. But any changes to the IEP really need to be team decisions, and that needs to include you. And they also should be data based. And then, you know, one thing that a lot of families don't know, especially that have kind of younger children, they might be turning, you know, 12, 13, is when your child turns 14, they actually should be invited to the meeting, and if it's appropriate, they can participate in the meeting. And if they're able, they should certainly weigh in on, you know, what their interests are, what their goals are, what they would like to target and do, what they see as being problematic. You may consider, if you're unhappy at all with the school team, you may consider consulting or kind of more formally hiring an educational advocate or consultant or an attorney. There's also something I wanted to draw everyone's attention to called an independent educational evaluation, or an IEE. And the point of that is really if something doesn't feel quite right about the educational evaluation that your school conducted, you actually have the ability to request an IEE and get an outside evaluation. So that's something just important to kind of keep in the back of your mind. One thing that I actually forget now where I even heard this, but one thing that has been recommended, I think is so helpful, These IEP meetings can often be, it's a lot of information. It can be kind of high emotion. Parents often feel really anxious about it. And I think a lot of parents are, have trouble kind of being present in the meeting because they're trying to take notes. They're trying to kind of look through documents. They're trying to think through all of the kind of papers in front of them and take all these notes on their laptop or on paper. It can be really helpful to actually bring someone with you. So say like a grandparent or a friend, to have strictly as a note taker. And so you're taking that kind of burden off yourself, and you can really be present and really kind of hear what the team is saying and have really kind of a thoughtful discussion. You should think about the IEP as a legal document, and as a contract. And it's really important just not to sign anything unless you're sure. So we do have some resources here. If you guys want to, if anyone wants to take a picture of this slide with their phone or whatever the best way is for you to kind of save this, but these are some resources both at the Lurie Center and also specific to kind of Massachusetts. I do want to draw everyone's attention to the autism support centers in Massachusetts. There are 7 autism support centers, and they're based on your kind of geographic region. And those are just really, really important sources of support and information and resources. And we have a lot of things here at the Lurie Center. So I'll turn it back to Nicole just to go over some of the support that she actually is able to provide directly.
And Kirstin and Nicole, this is a great segue. I just wanted to jump in quickly. Nicole, one of the questions we did have via direct message, I think gets right to this information. So one of our participants has shared that it's really challenging and that there are really lengthy wait lists in their area for in-home services. While we know children should be receiving appropriate educational and behavioral supports through their school, tell us a little bit about what else we are able to offer at the Lurie Center to support behavior.
Yes, great segue. So we offer a number of behavior and safety classes through the Lurie Center that are open to all parents and caregivers. You don't have to have your child be a patient at the Lurie Center. We have Behavior Basics, which is a 3-class series. It's 3 consecutive weeks, 3 hours total, virtual, and it covers sort of an intro to ABA, but then gets into really concrete techniques and skills in terms of how you can develop a program at home, how you can think about utilizing reinforcement, how to do limit setting, and gets into various topics like that. So that's a great course, not just for folks who are new to ABA, but even if you've been exposed to it for a while, but you want to get a fresh take and talk with other caregivers and also learn more about how to do things at home. We also are really excited to be offering a brand new class, Parent CPI. That's Crisis Prevention Institute. Some of you may have children who are in programs where CPI is used to de-escalate challenging behavior. It also can be used for physical holding. This is new to CPI and new to us, and that we are offering to teach parents how to de-escalate challenging behavior verbally, non-verbally, and physically. So we actually teach physical interventions. It's a 4-class series. The first 2 classes are virtual, hour and a half each, and the second 2 classes are in person. So we really encourage, I think both classes go hand in hand nicely, but they certainly have a bit of a different flavor. So we encourage you to look at those. And then we have a class called Safety at Home and in the Community. And that one covers just all sorts of tips and techniques and things to think about your home, things to think about when you're in the car with your child, some of the things that you may or may not know about, and then also in the community, ideas of how we can continue to be safe in the community. So you can check out our website to get information. If you want to register for these classes, certainly you can give us a call at the Lurie front desk or send an email. And I think, as Anne said, our slides will be going out, so all this information will be sent to you.
Fantastic, Nicole. Thanks so much. That's really helpful. A couple of questions from our participants here in the last few minutes. Dr. Birtwell touched on this a little bit, reminding us in her talk that ABA goals can and should focus on building functional life skills and other skills. But Nicole, I wonder if you can expand a little bit on how ABA might be used to teach a new skill like communication or potty training versus simply modifying existing behaviors.
Yes, absolutely. So I think, as we mentioned, we'd start with assessment, right? We would get a sense of, like, let's say we're talking about toilet training, potty training. We would get a sense of what the child can do. And in that case, can the child pull down their pants? Can they walk into the bathroom? Can they, do they have some sort of basic skills like that? And then from there, we would think about different techniques, and it again would vary by individual as to how they best learn and how to then teach that new skill. Some might do best with modeling, right? Meaning that there's an adult who's showing what the skill looks like, and we're asking the child to then mimic us, and then there might be a reward or reinforcement for when they do so successfully. Some might do well with what we call a task analysis, where we break a complex task into individualized steps, and we teach each step in a chain. Sometimes we teach that forward, sometimes we go backward. And so those are a couple of examples of teaching techniques that we might use. They often will use reinforcement, where we are reinforcing these small steps and building up until we get the skill to be mastered, which, as we learn, also generalized and maintained over time.
Thank you, Nicole. That's really helpful. Now, Kirstin, next question for you. This is something that Nicole touched on a little bit in her talk as she was talking with us about some of the challenges of ABA. But as those of you who are in autistic spaces online know, we've really learned from autistic self-advocates that ABA can be experienced as harmful in some situations. How can parents and caregivers make sure that ABA programs are not harmful but helpful, and not trying to change the core features of autism?
Yeah, that's a really, really good question, and a really important one that I think we at the Lurie Center kind of think and talk about a lot. Again, I think it's really, really important for ABA to be, again, not so kind of prescriptive and rigid. And so we often talk about it being really strength-based, individualized. Again, I think it's really important to kind of think through everything is really mapping onto, I think probably one of the slides that really walked through what goals might want to look at. I think one of the most important ones to me is really quality of life, right? I think no matter what, I think everyone would agree that we really just want to try to optimize the quality of life of our patients and our families. And so it's really important to think through how ABA might be used perhaps in addition to other forms of therapy to try to make sure that skills are developed that are really meaningful for that family and that are based on strengths. And so, one thing that I've given a lot of thought to is just how to incorporate things like restricted interests into therapy and into treatment. And so while that might be a symptom criteria of autism, so specifically with regard to kind of preoccupations about specific things. So, some providers might try to, even so far as kind of discourage that. I think it's really important to think through, how can we actually take this really strong interest that might be inappropriate in some contexts, but how do we try to use this interest or use this actually kind of symptom of autism and try to bolster other skill areas or try to use it in their life in a very productive way. And so I would just kind of go back to this idea of it being so heavily individualized. And I think listening to the voices of the caregivers and the child is really the most important thing.
Really helpful reminder, Kirstin. I love that focus on quality of life. And related to that, I wonder if you all might talk with us a little bit about the sort of course of treatment throughout one's lifespan. So, do people with autism need ABA forever? And can you talk a little bit about how treatments might ebb and flow across the lifespan?
Yeah, that's a really good question. And so again, it really just depends on the child. I think we talked about considerations that might be at play. Again, the age of the child is one. Also cognitive level and developmental level were other ones that were mentioned. the family values, the family culture is also really important. I think it's just trying to think through at each given life stage, I think that's why one of the benefits that I see of ABA very strongly is the focus on assessment. I think that, we don't kind of do enough assessment in other domains of, in across other treatment methodologies. And so I think having the wealth of assessment that ABA does generate is really helpful in our decision making. And so what that means is that, we're always thinking through, we're always, assessing the goal areas, we're always assessing the skills, we're always really thinking really critically about how we can do things better or how things have shifted. So, when at the Lurie Center, we follow patients across the lifespan. And so we have the luxury of being able to follow patients when they're quite young and perhaps getting a diagnosis all the way through school age, through adolescence, and even into adulthood. And what I've experienced clinically that, I just kind of didn't get in my training or read from a book is really the beauty of how these different life stages really do change. And, individuals just really function quite differently in these different developmental stages. And so it's really trying to think through at each developmental stage, we're not just going to kind of blindly keep applying ABA. It's very possible, and a lot of our patients do require more intensive ABA when they're younger. And then ABA kind of takes a different form or kind of is even phased out later on in kind of later childhood. And so ABA does not need to be in any way delivered across the lifespan. For some of our patients, it is, and I think it's an important methodology to use to train certain skills and to really think through how to build things like, it might start with things like toilet training and matching colors. And then eventually ABA might be used, for vocational training. And so I think that it's one really, one thing that I say pretty frequently to families is that, ABA is always kind of talked about as a treatment. I think about it not as a treatment, but as Nicole said at the very beginning of this talk, it's more an educational and kind of teaching methodology. And so, like Nicole was saying, it can be applied to, kind of a lot of different scenarios. I use ABA with my own kids quite a bit. I probably use it with my husband as well. So, ABA can really be used in a lot of different ways. And I think it's not as narrowly defined as I think people might assume going into it.
Thank you, Kirstin. I appreciate that answer there. We are just right at the hour, and I want to be respectful of everybody's evening. I do want to acknowledge we have one really sort of weighty question in the chat, and I've taken a screenshot of that so that we can talk about that as our team and potentially think about figuring out a way to answer that and address that in one of our upcoming coffee convos. So I don't want you to think we're ignoring that question, but we are right at the hour. I thank you guys for joining us this evening, and for Nicole and Kirstin for your time and expertise. And as Anne reminded us at the beginning of the hour, please feel free to join us again in January for a really interesting and great discussion on the therapeutic value of games and gaming with children and teens. An interesting topic as we exit the holiday season where our kids may have been on screens more than we wanted. So we hope to see you all again in January, and hope you all have a wonderful and restful time of year.